mental health and well-being in educational settings, and is able to make a contribution towards the society. Mental health includes understanding and managing your emotions, thoughts, and overall mental state. According to the psychological perspective, mental health is a state of mind characterized by emotional well being, good behavioral adjustment, freedom from anxiety, and a capacity to establish constructive relationships and cope with the ordinary demands and stresses of life. Now, the question is why mental health is important in our day to day life. The World Health Organization reports a sharp rise in the number of people experiencing mental illness in recent years, with the COVID 19 pandemic exacerbating mental health problems throughout the world. Even before the pandemic, mental health was a prominent concern for students. In 2019, the National College Health Assessment noted that many students reported feeling exhausted, lonely, and overwhelmed, among other symptoms and difficulties. Of the surveyed students, 20.2% reported experiencing depression and 27.8% reported experiencing anxiety that affected their studies in the preceding year. Actually, while navigating educational and career goals and combating personal challenges, your mental health hugely impacts the overall quality of your life. Therefore, mental health is important. According to World Health Organization, the self-harm rates in the adolescent age group are found in the highest numbers at a global level. Emotional stress and other concerns are a major contributing factor for most of the physical illness. Mental health care providers like psychiatrists, clinical psychologists, counselors, and allied professionals agree that early intervention can prevent many future mental health conditions. Further research finding suggests that factors like physical illness, limited basic resources, inability to provide for self and family, as well as unfulfilled desires in life, are major factors that impact mental health and well being. According to Mr. Dharmendra Pradhan, Minister of Education, Skill Development and Entrepreneurship, Government of India, the mental health is extremely important in schools as they have an essential role to play in supporting students to enable a state of well-being where students can meet their learning potential, cope with the stress, and openly connect with their friends and community. It is in this context Manodarpan, an initiative, was launched by the Ministry of Education under the Atmanirbhar Bharat Abhiyan to address mental health and well-being concerns of students. Along with various other activities, a mental health survey was conducted by the Manodarpan Cell NCRT on the students across the country. This is the first time that such a comprehensive survey on mental health of school-going children has been conducted. This survey will certainly be useful for teachers, educational administrators, policymakers, and educationists for preparing the planning. Understanding the impact of mental health on learning. Importance of awareness. Understanding the impact of mental health on learning is crucial for educators and policymakers as it directly affects students' academic performance and overall well being. Students experiencing mental health issues may struggle to concentrate, retain information, and engage in classroom activities. Supportive environment, that is, by recognizing the signs of mental health issues in students, educators can provide appropriate support and resources to help them succeed academically and emotionally. Creating a supportive and inclusive learning environment can improve students' mental health outcomes and enhance their overall learning experience. Mental health disorder. There are some mental health disorder that, that are anxiety disorders, behavioral and emotional disorders in children, bipolar affective disorder, depression, disso- disassociation and dissociative disorders, eating disorders, obsessive compulsive disorder, paranoia, post traumatic stress disorder, psychosis, schizophrenia. Strategies for promoting positive mental health in schools. Supportive resources are one strategy for promoting positive mental health in schools is to provide students with access to mental health resources such as counseling services and support groups to help them cope with stress and emotional challenges. Awareness programs are also there. Another effective strategy is to create positive and inclusive school environment by promoting mental health awareness through educational programs, workshops, and events that focus on self-care, resilience, and emotional well-being. Recognizing signs of mental health issues in students. Importance of recognizing signs. Recognizing signs of mental health issues in students can be challenging, but it is crucial for providing appropriate support and intervention. Some common signs include changes in behavior, mood swings, social withdrawal, and declining academic performance. Early intervention is key. It is important for educators and school staff to be observant and proactive in identifying these signs early on to prevent worsening of mental health issues. Providing a safe and supportive environment for students to talk about their feelings and seek help is essential in addressing mental health concerns. Supporting students with anxiety and stress. Importance of support. It is crucial for educators to provide a supportive environment for students experiencing anxiety and stress, as these conditions can significantly impact their academic performance and overall well being. By offering understanding, empathy, and resources, teachers can help students manage their symptoms and feel more comfortable in the learning environment. Effective strategies are there. In addition to emotional support, teachers can also implement strategies such as creating a react- predictable routine, providing clear instructions, and offering breaks when needed to help students with anxiety and stress. These accommodations can help students feel more in control and reduce their feelings of overwhelm and panic. Building resilience for students. Building resilience in students involves equipping them with the skills and mindset to navigate challenges and setbacks effectively. By fostering a growth mindset and teaching coping strategies, educators can help students develop the ability to bounce back from adversity. Resilient students can better equipped to handle stress, manage their emotions, and persevere through difficult situations. They are able to adapt to change, learn from failure, and maintain a positive outlook even in the face of obstacles. Educators can promote resilience in students through creating a supportive and nurturing environment, encouraging problem solving skills, and fostering a sense of self efficacy. By empowering students to overcome obstacles and build resilience, they can help them thrive academically and personally. Creating a safe and supportive school environment. Importance of safety. Creating a safe and supportive school environment is crucial for the well being and success of students. Importance of collaboration. Collaboration with parents and mental health professionals is essential in providing comprehensive care for children and adolescents with mental health issues. By working together, parents can provide valuable insights into their child's behavior and emotions, while mental health professionals can offer expertise in diagnosing and treating mental health disorders. Key components of collaboration. Effective communication and mutual respect between parents and mental health professionals are key components of successful collaboration. Building a strong partnership allows for a more holistic approach to treatment, ensuring that the child receives the best possible care and support. Implementing mental health education in the curriculum is crucial to address the growing mental health crisis among students. By interesting mental health education into the curriculum, students can develop a better understanding of mental health issues and learn how to cope with the stress and anxiety. Furthermore, incorporating mental health education in the curriculum can help reduce stigma surrounding mental health. By normalizing conversation about mental health in the classroom, students are more likely to seek help when needed and support their peers. Overall, implementing mental health education in the curriculum can contribute to creating a supportive and inclusive learning environment for all students. By providing students with the necessary knowledge and skills to manage their mental health, schools can help promote overall well-being and academic success. Importance of addressing bullying. Addressing bullying and its effects on mental health is crucial in promoting a safe and supportive environment for all individuals. By implementing preventive measures and providing support to those affected, we can work towards reducing the negative impact of bullying on mental health. Promoting empathy and respect. It is important to raise awareness about the harmful consequences of bullying on mental health and to encourage open discussions about the issues. By creating a culture of empathy and respect, we can help prevent bullying and support those who have been impacted by it. Self care for educators and school staff. Importance of self care. Educators and school staff play a crucial role in shaping the minds of students, but it is important for them to prioritize their own well being as well. Taking time for self care can help prevent burnout and ensure that educators are able to perform at their best. Different forms of self care for educators can take many forms, such as practicing mindfulness, engaging in physical activity, or seeking support from colleagues. It is essential for educators to find activities that help them relax and recharge outside of the school environment. Setting boundaries and learning to stay no can also be important aspect of self-care for educators, as it can help prevent feelings of overwhelm and exhaustion. By prioritizing their own needs, educators can better serve their students and create a positive learning environment. Not selfish necessary. Ultimately, self-care for educators is not selfish, but rather a necessary part of being able to effectively support and educate students. By taking care of themselves, educators can ensure that they have been they have the energy and motivation to continue making a positive impact in the lives of young people. Resources and tools for promoting mental health in educational settings. There are many resources and many tools for promoting mental health. Like educational settings can utilize resources such as counseling services, mental health workshops, and support groups to promote mental well-being among students and staff. These tools can help create a supportive environment that fosters positive mental health outcomes. Additionally, educational institutions can implement strategies such as mindfulness activities, stress management techniques, and mental health awareness campaignings to enhance mental health awareness and reduce stigma. By providing these resources and tools, schools can contribute to a culture of well being and resilience within their community. Conclusion. Achieving success in all areas of life requires both physical and emotional fitness. Students' mental health and well-being is very much supported by schools. Schools can help these students with interventions, support groups, and therapies. These resources can help reduce the negative impact on mental health. Good mental health can lead to improved social connections and better relationships with peers, family, and friends. Mental health awareness is an important initiative to improve understanding of mental health conditions and increase access to healthcare for those who need it. Education can also lead to more accurate health beliefs and knowledge, and thus to better lifestyle choices, but also to better skills and greater self advocacy. Thank you.